And we are back with Valley Life. I'm Kevin Miller, and we are here at Fresno Surgical Hospital with Dr. Mehdi Gajjar. Dr. Gajjar, nice to meet you. Thanks for joining us.
Pleasure. Thank you.
All right, now you, along with 4 ophthalmologists, have partnered with Fresno Surgical Hospital to offer the Central Valley advanced surgical eye care. Can you share with us a little bit about the procedures that take place here at Fresno Surgical Hospital?
Sure. Well, I myself am a cataract and refractive surgeon, which means that I do cataract surgery as well as LASIK. I also do cornea transplantation. And so those are some of the things I do here. I do other surgeries such as pterygium or complications of previous cataract surgery. We take care of those patients here as well, and we get referrals from all over the Central Valley. One of the pleasures of coming to Fresno Surgical Hospital has been the new equipment and the new technology that we've gained access to. And the main equipment that we're very excited and we've been using for actually the past 2 years has been the LensX cataract assisted machine.
Fantastic. Could we take a look at it? You kind of tell us a little bit about it and share?
This is the LensX laser, and what it is, it's the latest technology. It uses a laser called femtosecond laser, and it assists us in doing cataract surgery. So the mechanical portions that were previously done by the hand, it's automated and made extremely precise by this technology. It breaks the cataract into pieces, and it makes incisions on the cornea, and it also does something that treats astigmatism on the cornea as well. With the incisions on the lens of the eye, it also helps to center the lens, the intraocular lens inside the eye, and all these things add up to possibility of getting near perfect vision, both at distance and even for people that get higher technology lenses, and ability to be able to read without glasses after cataract surgery.
And that's the objective of your patients, near perfect vision, correct?
That's right. I mean, as we've become more technologically advanced, even our seniors, their expectations are very high, and we're excited to be able to provide that to them. Previously, it was the case where people would have cataract surgery and they just want to get rid of their extreme blur, and then they would wear glasses. But now, the modern sort of educated senior, what they want is not just to get rid of the cataracts, but they want to have full independence from glasses. And we can approximate that as much as possible with the equipment that we have available here, including with the LensX laser.
And speaking of that equipment behind you, kind of this gold platinum plated item, can you share with us a little bit?
This is the latest Alcon cataract surgery extraction machine. And so the first step in a laser assisted cataract surgery is where we do our incisions and breaking up of the cataract with the LensX. Then we move over into the surgical area where we utilize the phaco machine in order to aspirate the lens out. And this technology is an advancement on previous phaco machines, because what it does, it allows for additional control inside the eye. The fluidics inside the eye are much better controlled, and so you don't get the drastic elevations and decreases in pressure that you would get with the older technology. It cuts down the amount of energy that's used inside the eye, making it much safer, avoiding complications for cataract surgery. And so this technology we first started to use about 1 year ago, and it's been exceptional. I mean, it's really made the surgeries, even for the really hard cataracts, much safer and easier.
Okay, so what was once really effective is even more so now, and safety is the key.
Increased safety as well, yes.
Okay,
that's
so this
great.
is kind of the surgical piece.
Yes.
And then we move over to one more technological item.
Right. This is the Luxor microscope, and it's an extreme advance, I think, on the visualization that we had during cataract surgery previously. When we used to look at the cataract only in one direction, would we be able to get that nice red reflex. And the red reflex is what you see when people get their pictures taken and get the red eye. That's actually extremely useful in cataract surgery, because it gives us visualization of the clear parts of the eye that we really need to be seeing during surgery. And so with this technology, along with the phaco machine, that is their newest one, as well as the LensX, we have a system called the refractive suite. And it takes images from before surgery in our clinic, and it incorporates it into a fine-tuned and precise cataract extraction and lens implantation scheme. And in addition to just the microscope and the advances that it has in how it allows the surgeon to see inside the eye, there's something called the Varion system, which is this monitor that you see here. The Varion is used both on the laser machine as well as on the microscope during surgery. and it takes those images that were done in the clinic, it overlays them during the surgery and allows for precise orientation of the lenses. Especially people that have high astigmatism, it's extremely important to get that astigmatic lens, the artificial lens, oriented precisely. And so it gives us an overlay, just like if you're looking through, let's say, Google Glasses, and you see that overlay that's in front of you, and it allows us to position that lens so perfectly to where it needs to be in order to have the best visual outcome after surgery.
Remarkable. I learned so much, and certainly one of the biggest names is Fresno Surgical Hospital. Dr. Mehdi Gajar, thank you so much for joining us.
My pleasure.
Right on, and we'll be back with more Valley Life right after this.